Hi, Great Danes. My name is Molly, and I am the Alcohol and Other Drug Prevention Graduate Assistant at Albany.
Today, we're going to talk about strategies for safer cannabis use. It's important to keep in mind that the only way to completely avoid health risks is by choosing not to use cannabis. However, if you decide to use cannabis, we have some strategies that can help lower risks to your health.
First, we encourage people buy or obtain cannabis from the same trustworthy person every time. This way, you are knowledgeable about the product and how it impacts your body. If you're now living in a new area and it's not possible to buy from the same person, try using a small quantity of any unfamiliar product for the first time to see how it impacts your body. Next, if you'd like to make some changes regarding your cannabis use, try these 3 strategies. First, reduce the number of times each day you use. Next, try using at a different time of day. For example, if you regularly use in the morning, try limiting yourself to only using in the evening after all your daily commitments have been met. Finally, try using in smaller quantities. THC levels in cannabis have increased dramatically over the past 30 to 40 years, meaning today's cannabis causes a much more intense high and longer high. Remember, cross-fading or using cannabis and alcohol together magnifies each drug's effect and can lead to negative consequences and an unpleasant experience. For that reason, we recommend that you do not use these at the same time. If you choose to use cannabis edibles, just remember, these aren't your grandma's brownies. Edibles contain high doses of THC, and because you are eating it and your body has to digest it, it can take hours for you to feel any effects. Keeping this in mind, here are some helpful guidelines for edible use. Number 1, clear your schedule and be in a safe space. Number 2, eat a meal and hydrate before using. Number 3, start with a dose of 10 milligrams or less. Number 4, if you don't feel anything, make sure to wait 3 hours before eating more edibles. And number 5, if you do get too high, try not to panic. Eat some food, drink water, and try to distract yourself. If you are really worried about your well-being, reach out to emergency medical services. And finally, never drive after using cannabis. Driving while impaired by any substance, including cannabis, is dangerous and illegal. Cannabis negatively affects a number of skills required for safe driving. The most recent research suggests waiting a minimum of 6 hours after using cannabis before getting behind the wheel. I hope this video gave you some strategies for using cannabis safely. For more information, check out the link provided with this video. Take care, Great Danes.